Knee joint, type synovial, variety, modified hinge variety. In hinge variety, there are two movements, flexion and extension. In addition to flexion and extension, there is a certain amount of medial and lateral rotation possible in the knee joint. Hence, it is a modified hinge variety. Articular ends. Proximally. So, this is the femur. Proximally, okay. Inferior articular surface of medial condyle, inferior articular surface of lateral condyle, and the trochlear surface of femur. So, proximally there are three articular surfaces. Okay. Inferior articular surface of medial condyle, inferior articular surface of lateral condyle, and the trochlear surface. Distally, okay, this is the tibia, this is the medial condyle, and this is the lateral condyle of tibia. So, distally, the superior articular surface of medial condyle of tibia, the superior articular surface of lateral condyle of tibia. Anteriorly, the posterior articular surface of patella. So, this is the patella, the largest sesamoid bone. So, the posterior articular surface has a larger lateral part and a smaller medial part. So, this articulates anteriorly. So, patella articulates in the trochlear surface, whereas the medial and lateral condyles, that is the inferior articular surface of medial and lateral condyles of the femur articulates with the superior articular surface of medial and lateral condyles of tibia. So, this is the articular ends of the knee joint. Ligaments. Number 1, capsule. Number 2, tibial collateral ligament. Number 3, fibular collateral ligament. Number 4, medial and lateral meniscus or semilunar cartilages. Number 5, cruciate ligament. There are two cruciate ligaments, anterior and posterior cruciate ligaments. Number 6, coronary ligament. Number 7, transverse ligament. Number 8, ligamentum patellae. Capsule. It is a loose fibrous sac which encloses the joint cavity. Attachment. Proximally, it is attached to the posterior, medial and lateral surface of the condyles except anteriorly where the capsule is deficient. So, attachment, posterior intercondylar line, posterior margin of the medial and lateral condyles of femur, margin of the articular surface of the medial condyle, laterally margin of the articular surface of the lateral condyle, proximal to popliteal groove. So, it runs near the posterior end, it runs proximal to the popliteal groove. So, the popliteus muscle becomes intracapsular. Anteriorly, it is deficient. Distally, the capsule is attached to the margins of the articular surface of medial and lateral condyles of tibia except anteriorly where the attachment extends to the tibial tuberosity. So, the capsule is deficient anteriorly. It is closed or strengthened by ligamentum patellae, patella, medial patella retinaculum, lateral patella retinaculum, and the tendon of quadriceps femoris. There is also a deficiency on the posterolateral aspect of the capsule through which the tendon of popliteus exits. So there are two deficiencies in the capsule. The capsule is lined by, the inner surface of the capsule is lined by synovial membrane. So the synovial membrane lines the inner surface of the capsule and also the non-articular parts of the condyles of the tibia and femur of the knee joint. The inner surface of the capsule and the non-articular portions of the femur and tibia are lined by synovial membrane. The synovial membrane is attached to the margins of the medial and lateral condyle of tibia. The synovial membrane is related to the anterior and sides of the cruciate ligaments, thus dividing the joint into two halves. The synovial membrane extends into the upper part of the thigh between the femur and quadriceps femoris, where it is attached to the articularis genu. Medial ligament of knee joint or tibial collateral ligament. Proximally, it is attached to medial epicondyle of femur. Distally, it is attached to the medial margin and adjoining medial surface of shaft of tibia. So, it is attached to the upper 5 cm of the medial margin and adjoining medial surface of the shaft of tibia. So this is the femur, this is the medial condyle. Tibial collateral ligament, proximally it is attached to the medial epicondyle. Distally it is attached to the, this is the medial margin. So distally it is attached to the upper 5 cm of the medial margin and adjoining medial surface of shaft of tibia. Morphologically, it represents the degenerated portion of the tendon of adductor magnus, fibular collateral ligament. Proximally, it is attached to lateral epicondyle of femur. Distally, it is attached to the head of fibula, just in front of the styloid process. So this is the lateral condyle. Okay, the popliteal groove. Above that, this is the lateral epicondyle. So proximally, the fibular collateral ligament is attached to the lateral epicondyle. Distally, it is attached to the, this is the head of fibula, it is attached to the head of fibula in front of or anterior to the styloid process of fibula. The fibular collateral ligament is embraced by tendon of biceps femoris. Semilunar cartilage or menisci. There are two semilunar cartilage or menisci. One is lateral meniscus and another one is medial meniscus. These two semilunar cartilages are present on the superior articular surface of the medial and lateral condyles of tibia. So this is the superior articular surface of the medial condyle. This is the superior articular surface of the lateral condyle. So according to this articular surface, okay, there is a cartilage present. So what is this meniscus or semilunar cartilage? It is a fibrocartilaginous structure. It is a fibrocartilaginous structure present on the superior articular surface of the medial and lateral condyles of tibia. Medial meniscus. It is C-shaped or semilunar in shape. It has two surfaces, superior surface, inferior surface. Two borders, outer border and inner border. Two ends, anterior horn of medial meniscus, posterior horn of medial meniscus. Lateral meniscus. It is circular in shape. It has two surfaces, superior surface and inferior surface, two borders, outer border and inner border, two ends or horns, anterior horn of lateral meniscus, posterior horn of lateral meniscus. Okay. The outer margin of the medial and lateral meniscus are attached to the articular surface, margin of the articular surface of the condyles by a short vertical ligaments known as coronary ligaments. So coronary ligaments are vertical fibers, ligamentous fibers which attaches the meniscus to the medial and lateral condyles of tibia. Anteriorly, these two ligaments will be attached by a transverse ligament. So this is the transverse ligament which attaches the anterior aspect of the medial and lateral meniscus. It is intracapsular. The transverse ligament is intracapsular. See, the meniscus is responsible for forming the concavity of the, increasing the concavity of the articular surface of medial and lateral condyles of tibia. It also acts as a cushion, thus prevents the friction between the tibia and femur during articulation and also during transmission of the weight. They are avascular, and injury to meniscus takes a long duration in healing. The medial meniscus is attached to the inner aspect of the tibial collateral ligament, whereas the lateral meniscus is separated from the fibular collateral ligament by tendon of popliteus. Cruciate ligaments. There are two cruciate ligaments. Cruciate means crossing over, so like this zigzag, okay, crossing over. So anterior cruciate ligament, posterior cruciate ligament. Anterior cruciate ligament, okay, distally it is attached to the anterior part of the intercondylar area. This is the lateral condyle, this is the medial condyle, this is the intercondylar area between the two articular surfaces. This is the intercondylar area. The intercondylar area has anterior part, posterior part and middle and eminence, intercondylar eminence. So behind the intercondylar eminence, this is the posterior part of the intercondylar area, and in front of the eminence, this is the anterior part of the intercondylar area. So the anterior cruciate ligament, this is the anterior cruciate ligament, is attached to the anterior part of the intercondylar area between the anterior horn of lateral meniscus and the anterior horn of medial meniscus. So distally it is attached to the anterior part of the intercondylar area between the anterior horn of lateral meniscus and anterior horn of medial meniscus. Proximally, so the ligament runs backwards, ligament runs backwards and upwards. So this is the lateral condyle of tibia, and it is attached to the posterior part of the medial surface of lateral condyle. Posterior part of the medial surface of the lateral condyle. So this is the area where it is attached. Posterior cruciate ligament, it is attached to the posterior part of the intercondylar area behind the posterior horn of medial meniscus. Proximally, the ligament runs forwards and upwards, so it is attached to the anterior part of the lateral surface of the medial condyle. Anterior part of the lateral surface. This is the lateral surface. So anterior part of the lateral surface of the medial condyle. So these cruciate ligaments are responsible for maintaining the stability of the knee joint, thus preventing the anterior and posterior displacement of the condyles of tibia and femur during walking. Ligamentum patellae. The tendon of quadriceps femoris muscle. After enclosing the patella, continues as ligamentum patellae. So proximally the ligamentum patellae is attached to the patella. Distally it is attached to the tibial tuberosity. Relations of knee joint. Anteriorly it is related to ligamentum patellae, patella, and tendon of quadriceps femoris. So from above downwards, you can say anteriorly, it is related to tendon of quadriceps femoris, then patella, then ligamentum patellae. Anterolaterally, lateral patellar retinaculum. Anteromedially, medial patellar retinaculum. What is patellar retinaculum? It is a fibrous extension derived from the lower end of the vastus medialis and vastus lateralis. Posteriorly, it is related to the popliteal artery, popliteal vein, tibial nerve, medial end of gastrocnemius, and lateral end of gastrocnemius. So these are the structures related posteriorly. Posteromedially, it is related to tendon of gracilis, sartorius, and semitendinosus. So sartorius, gracilis, and semitendinosus tendon. The semitendinosus is separated from the capsule of the knee joint by semimembranosus. So these are the structures forming the posteromedial relation. Posterolaterally, it is related to tendon of popliteus, which is intracapsular, and tendon of biceps, which is outside the capsule. So this is the tendon of popliteus, this is the tendon of biceps femoris. It is outside the capsule, this is inside the capsule. And one more structure is common peroneal nerve. So this is the common peroneal. So these forms the posterolateral relations. So these are the relations of the knee joint. Blood supply. The knee joint is supplied by, number 1, superior medial genicular artery. Number 2, superior lateral genicular artery. Number 3, inferior medial genicular artery. Number 4, inferior lateral genicular artery. Number 5, middle genicular artery. Number 6, descending genicular artery. That is a branch from the femoral artery. So these are the blood vessels which supplies the knee joint. So this forms an anastomosis around the knee joint. So blood supply, the arteries which forms anastomosis around the knee joint supplies the knee joint. Nerve supply. Number 1, articular branch from femoral nerve. It arises from the nerve to vastus intermedius and it supplies the knee joint. Number 2, articular branch from the obturator nerve, that is the descending genicular branch of the obturator nerve supplies the knee joint. Number 3, genicular branch from tibial nerve and common peroneal nerve. So these are the articular branches which supplies the knee joint. Movements. Flexion, extension. So flexion of knee joint. Okay, the muscles responsible are number 1, popliteus, number 2, hamstring muscles, that is semitendinosus, semimembranosus and biceps femoris. Okay, number 3, okay, gastrocnemius. Number 3, gastrocnemius. Number 4, plantaris. See, the gastrocnemius and plantaris flexes the knee joint when it is on the ground. So now the person is standing, so flexion takes place like this. Okay, so flexion of knee joint. Okay, when you are flexing the leg, the flexion is caused by popliteus, hamstring muscles. Okay, whereas when the foot is on the ground, the flexion is caused by gastrocnemius and plantaris. Extension. So this is the extension. So the muscles present in the anterior aspect of the thigh. So extension, muscles responsible, quadriceps femoris and articularis genome. Okay. There is a slight medial and lateral rotation in the knee joint. Okay. During extreme extension, the thigh is rotated medially and it is screwed and locked in your home. Okay. During flexion, there is a reversible reaction, that is the thigh is rotated laterally and it is flexed. Okay. The muscle responsible for the locking and unlocking of the knee joint is popliteus. So this, okay, extension and medial rotation and flexion and lateral rotation of the knee joint, that is the screwing movement, is known as screw home movement or locking and unlocking movement of the knee joint. Applied anatomy. Applied anatomy. Number 1, housemaid or nun's knee or clergyman's knee. It is a condition in which the subcutaneous infrapatellar bursa gets inflamed due to prolonged kneeling. Bursitis of the popliteal bursa present posterolaterally near the tendon of popliteus. Okay. Due to stress or strain results in inflammation of the popliteal bursa. This condition is known as Baker's cyst. The medial meniscus is often injured due to its attachment to the tibial collateral ligament. So it is attached to the inner aspect of the tibial collateral ligament. So sudden jerky movement. Okay, in a semi-flexed knee joint, when there is sudden jerky movement, like footballers trying to twist their leg, that causes damage to the medial meniscus, since it is attached to the inner aspect of the tibial collateral ligament. Whereas the lateral meniscus is not injured because the lateral meniscus is separated from the fibular collateral ligament by tendon of popliteus. Referred pain. When there is a pain in the knee joint for a long period, chronic, long period, the pain is also referred to the hip joint since it is supplied by the same nerve. Pellegrini stida disease is a condition in which there is calcification of tibial collateral ligament occurs after trauma.